Classification of diseases. Hahnemann classified diseases into two types. One, acute diseases. Two, chronic diseases. Acute diseases. Acute diseases have three characteristics. These are: 1, short span; 2, severe symptoms; 3, onset, aggravation, prevention or death. Chronic disease characteristics. 1, it takes years together for these diseases to enter the constitution. 2, symptoms are not severe. 3, they have two phases only: initiation and aggravation. The third stage, that is, cure, is not found. Hahnemann classified acute diseases again into two types. They are: 1, false acute diseases; 2, local acute diseases. False acute diseases. These are also called temporary acute diseases. These are not true diseases, but develop due to changes in daily routine and as environmental diseases. They can be cured by modifying daily routine. These do not require medication. If symptoms do not recede, even after regulating the daily routine, 1 or 2 doses of medicine will relieve. Example 1. If a man takes stomach full of meals, he may feel heaviness, lack of appetite, or suffer from motions. In such a case, no medicine is required. Fasting for 1 session or day will relieve him. If required, 1 dose of Naxovamika or Antim-Crude will relieve. 2. If a man wakes up for days together, reeling and nervous weakness will start. If he takes rest, all these symptoms will relieve without any medication. If required, a dose of Cocculus indicus or Coffea will relieve. Stings and bites of poisonous animals and accidents also fall under acute diseases. These are not at all diseases in its true sense, but require immediate treatment. Local acute diseases. Acute diseases caused due to changes in the surroundings are called local acute diseases. Hahnemann classified them into 3 types. 1, environmental diseases; 2, epidemics; 3, typical acute diseases. 1, environmental diseases. These are endemic to specific region and occur due to changes in the local environment. Example, malaria fevers in forest areas, diseases due to mosquitoes, diseases due to taking stagnant water, etc. These diseases arise seasonally and some of the people living in that area affected. Changes in seasons and environmental conditions also contribute to the occurrence of these diseases. These may occur in inhabitation of the region or immigrants. Example, malaria, filaria, etc. 2, epidemics. These diseases arise all of a sudden in a particular area pollute the environment there, infect too many people in a short time, cause severe symptoms of high mortality and recede. Example: cholera, smallpox, plague, diarrhea, measles, chickenpox, brain fever, etc. 3. Typical acute diseases. Generally, persons with behavioral lapses are affected with these due to water contamination or food contamination during rainy season. Example: typhoid, jaundice, amoebiasis, dysentery, etc. Acute diseases do not affect people who do not have chronic myasthenia. Healthy people, if affected by acute diseases, can be restored to health just by adjustment in food, rest, and work patterns. They do not need any medication. When people who have deep-seated myasthenia are affected by acute diseases, unexpected things may happen with several symptoms. The acute disease may aggravate, leading to death if they do not receive proper treatment. While treating acute diseases, doctor has to be very cautious and alert. Observe the patient personally and use medicines with utmost care. Otherwise, patient may die. The doctor has to select an indicated remedy by observing the patient carefully and compiling the totality of the symptoms. Start treatment from low potency and use the same medicines or other indicated remedy repeatedly in short intervals and treat the patient. Otherwise, it will not be cured. Principles to be observed while treating acute diseases. 1. After recording the totality of symptoms carefully, one has to select an indicated remedy and start treatment with low potency. If symptoms recede after giving one dose of the indicated remedy and then reoccur after some time, the same remedy should be repeated in the same potency. While treating acute diseases, there is no need to follow the rule of time interval for repeating the remedy. It should be remembered that the time of recurrence of symptoms itself is the time for repetition. 2. When symptoms recur after giving 2 doses of the indicated remedy in a particular potency, the same remedy should be used in higher potency. If symptoms do not repeat, there is no need of medicine again, but if symptoms aggravate, the indicated remedy should be given twice in the same potency with an interval. Potency should be gradually increased till the symptoms disappear. During this treatment, the doctor should observe the patient personally. 3. While treating acute diseases, if symptoms aggravate after giving the indicated remedy, we should know that it is not the remedy required. In such a case, we have to carefully compile the totality of the symptoms again and select the suitable drug. Food required for patients suffering from acute diseases. 1. Tender coconut water. 2. Dry dates and dry raisins. 3. Buttermilk, milk, Horlicks, Bournvita, etc. Patients should take easily digestible food for 1 or 2 weeks after recovering from an acute disease and take sufficient rest.